It's 2 minutes after 3. We are happy to see you all here today for this event, celebrating and caring for loved ones with memory loss during the holidays. My name is Ilma. I'm the coordinator of the Center for Healthy Aging Innovation, and I would just like to take a couple of minutes up front to introduce a couple of logistics for you all. Throughout the webinar, please, as questions come up for the speakers, enter them in the Q&A feature on the bottom of your Zoom screen. And we will have 20 minutes at the end of the session reserved for just that, for your questions and for interaction with our panelists. We have a great lineup of speakers today. You will love them. Also, use the chat feature to share stories and any resources that you think would be good to share with other caregivers during this time of the year, during the holidays. So questions in the Q&A and your stories, experiences you would like to share in the chat. And at the end, we will invite you to please take a brief survey to share your experience, how we did today, because we want to keep offering engaging, meaningful events to our community. So without further ado, thank you very much to our sponsors. We would like to recognize, and we are honored to partner with these great community-based organizations, the Center for Healthy, Robert J. Jones, Urban Research and Outreach Engagement Center, Volunteers of America, Phyllis Wheatley Community Center, and the Minnesota WEP, North Star Geriatrics Workforce Enhancement Program. And a special thank you to Nancy, who is joining us from the MDH Community Health Division. And here I will hand it up to Ms. Dorothea Harris.
Wonderful, wonderful. Thank you, Ms. Alma. I'm Dorothea Harris, and I am the Director of the Culturally Responsive Caregiver Support and Dementia Services with Volunteers of America. And we are delighted to partner with the Center for Healthy Aging and Innovation this evening, celebrating and caring for a loved one with memory loss during the holidays. Now, just a few words about the Culturally Responsive Caregiver Support and Dementia Service team. We are focused on working with older adults and care partners who reside in the community and are people of color. Our office is located in North Minneapolis in the beautiful Center for Families building on North 4th Street. We have a mighty team of social workers, Ms. Tuesday Glover and Ms. Carolyn Smith, our community health workers, Ms. Monisha Washington Richard, who regrettably will not be able to join us this evening, our CHW health educator, Gloria Coles, who assisted our team to win the 2020 National Caregiver Award earlier this year. She will be presenting this evening, sharing some tips and techniques that are sure to promote a safe, happy, and joyful holiday season. Our team of professional and passionate workers are providing virtual community education programs, caregiver support groups, and faith-based services. We have provided a helpline number to make it easy for you to reach out to us, that we can hear more about your needs and how we can serve you. We have services such as a senior lending library, a healthy aging mobile clinic, powerful tools for caregiver classes, dementia support programs, and care partners. Be sure and ask about our self-care packages. Our helpline number is 952-945-4034. That's 952-945-4034. We would be delighted to hear and meet you. This evening, I am joined by my colleague and new friend, Ms. Makeda Zulu. Please welcome her as she shares her programs and what goes on at the Robert J. Jones Urban Research and Outreach Engagement Center, better known as UROC. Ms. Makeda?
Thank you so much, Ms. Dorothea. So I'm so happy to be here as a co-sponsor for this conversation today. And you may or may not know, but the University of Minnesota Robert J. Jones Urban Research Outreach and Engagement Center was created to recognize both the land grant and Research One missions of the University of Minnesota. One of the ways we do that is demonstrated by this conversation today, where you have experts and practitioners along with experts within the academy coming together to talk about solutions. How do we address the holiday season and being good caregivers and taking care of ourselves during this time? Some of the experts that are on today and one that is not, Ms. Carolyn Smith and Ms. Tuesday Glover, are people who go way back in this community. So that helps give us credibility when we're talking about this conversation. And another one of my favorite people is Ms. Patricia Jones, who's located out of the Fellowship Church. I forget the name of the actual center inside there, so forgive. Center for Families, located on 4th Avenue in North Minneapolis. So UROC is happy to be a co-sponsor to partner with, because we know that we don't have all of the answers, but the answers lie within the communities of the university and the urban core around it, along with many of our folks in greater Minnesota. And with that, I will hand it off to Miss Robin Frazier, who has put this incredible team together and will lead us in this conversation.
Welcome, everyone. I would like to thank you for being here with us. I am a part of the Center for Healthy Aging and Innovation. The center is led by Dr. Joe Gogler, who is here with us today. Our plan for today is that I will briefly talk about CHAI, so you have a little bit more information, and cover the 10 early warning signs for Alzheimer's and other forms of dementia. And then you're going to hear about, I should say, coping with the mixed feelings and stressors during the holiday season. Ms. Gloria Coles will cover that. We're also going to hear about the important work at MDH and their partnership with community organizations. Ms. Nancy Lee will be covering that. And then we have Mr. Armando that will be talking about tips and resources for the holiday. We do ask that you hold your questions to the end or put them in the Q&A, but we do plan to have at least 15 to 20 minutes for open question and answer. Next slide, Elma. In terms of the Center for Healthy Aging and Innovation, I really appreciate that we have a bold vision, and was very happy to join Dr. Joe Gogler's team, to work on this vision. And so our vision is a community, state, tribal, nation, country, and world where every individual can achieve their life goals while aging. And to accomplish that, we have a mission to advance interdisciplinary science. We want to create immersive educational experiences, and that will involve connecting our students with community partners and organizations. We've already begun that work. And we will use our findings from the research to improve quality of life and quality of care. And this today's workshop is an example of the vibrant collaborations that are so important to achieving our mission. the Center for Healthy Aging and Innovation has 3 core areas. We have an education core that is led by Dr. Rajan Moon. We have a research core led by Dr. Tetyana Shippey. Many of you have been at her events that have been held at UROC when we've had community forums. And my responsibility on the team is to lead the equity and community engagement work. And that work is focusing in on advancing health equity for Black, Indigenous, people of color, LGBTQ, members of our community, and other underserved aging communities, such as our immigrant and refugee communities. As we approach the holidays, I know that many of you on today's call are caregivers. And so you have a lot of familiarity with Alzheimer's and other forms of dementia. So I'm just going to briefly highlight some information about Alzheimer's disease. And the warning signs and local resources. We want to share these because we know that there may be people that don't have a diagnosis yet, or maybe have some concerns as they approach the holiday. So I will provide a few brief highlights on this. In terms of the risk factors for Alzheimer's disease and related dementia, age is the greatest factor that is important in terms of the risk factor. What we know is that at age 65, the disease impacts 1 in 9 people, and at age 85, it impacts 1 in 3 people. And the really important takeaway is that Alzheimer's and other forms of dementia, they are not a part of normal aging. We also know that women are at twice the risk of developing Alzheimer's. When there's a first-degree family history with parents or siblings, that increases the risk. Genetics is a smaller component, but there are certain diseases that have a close genetic link. And we know that when people start experiencing mild cognitive impairment, those very early changes, that can place them at greater risk. So those first items there, they don't have the asterisks by them that you see, because, and also the last risk factor, Down syndrome, because those aren't things we can control. We can't control our age, our gender, those things, but we do have some capability to do modifications of some of the other risk factors. And those risk factors are the cardiovascular disease, diabetes type 1 and 2, and also protecting our brains in terms of head trauma. So to reduce your risks, these are the important risk factors to know. Alzheimer's disease is a disease that can affect anyone, but we do know that this disease disproportionately affects certain communities. And so women are twice as likely to develop Alzheimer's. We know that African Americans are also twice as likely than their white counterparts to have Alzheimer's or another form of dementia. And Hispanic Latinos are also at 1.5 times the risk of developing Alzheimer's. the 10 important signs that we want you to know coming into the holiday, so that you can recognize any changes that may be happening with your loved ones, is the first one is a sign is memory loss that disrupts daily life. So we're not talking about when we forget a name or appointment. For one of the cases that I know that relates to this is a gentleman that had general memory loss, but he reached a point where he called his wife because he wasn't able to make his daily peanut butter and jelly sandwich. He had some of the items there, but he couldn't put it together. So he called her for help and she thought he was joking, but he seriously was not able to complete his lunch that day when he reached out. Another sign is challenges in planning or solving problems. We know we all have those occasions where we may have trouble with our checkbook, those types of things. But for, and I know in our family, the way this has manifested is that some of the people that are the best cooks in the world were no longer able to follow their recipes and cook for memories. And now they're unable to cook. So being able to do things and then having those changes where you can't do that planning or problem solving. We also know that people have difficulty completing familiar tasks. One of the most recent families that I worked with, the matriarch was no longer able to make her grocery list, and she also was not able to clean things out of the refrigerator. And so we made arrangements for me to share some time with her, and the family did get her permission to clean the refrigerator. They took out 10 bags of expired food. And so again, a person with a well-managed home that now is not able to handle that food listing and preparation. Confusion with time and place. I spoke with a friend that called for advice. It was time for Christmas, but his mother was convinced they had not had Thanksgiving dinner and was refusing to let her son make arrangements to pick her up. And so he ended up just saying, "Mom, we're gonna have dinner." And he didn't argue with her, but because he understood the disease, and they just had a lovely dinner. But that loss of that timing. The other key factor is people can have confusion with understanding spatial relationships, so that can deal with driving, parking, where you're up on the curb, or maybe you're getting into some small accidents because you're not able to see the space.
Robin, excuse me to interrupt. You have about 3 minutes left.
Thank you. And Elma, if you advance to the next slide.
Sure.
Some of the other symptoms to be aware of when people have troubles with words, they may not be able to find that particular word that they want to use. And so they end up substituting. And one of the examples they'll say is people can't remember the word for watch, so they might call it a hand clock, for example. Another sign to know is misplacing things. And it's not when we leave our keys and we go back and figure out, oh, I went into the bedroom or I left them in my purse. It's when you can't retrace your day for that. Another symptom is decrease or poor judgment. And one of the families that I worked with were very generous, and the father would make donations. Well, as soon as you make a donation, as most of you know, you get an envelope for a new donation. And so suddenly his account didn't have the money for his rent. And it was because he was continuing to make donations and unaware of how they had accumulated. And then the other symptoms are the change in mood, and also maybe being less involved with social activities. And that's because people don't feel comfortable that they can remember names, or it's harder for them to participate in a special hobby. So these are the signs. And Elma, if you'll advance, what we've included here, and we will share the PowerPoints with you, are resources. And so one of the key resources for those of you participating is Volunteers of America. And if you advance to the next slide, Elma, the Alzheimer's Association has a 24-hour help and care line that is available also. And no question is too little or too small, but they will help you with those questions. And then we have many resources available locally. Next slide. And those are resources with our Minnesota Board on Aging. We've got the Senior Linkage Line. There's a Disability Line. We also have Dementia Friends. And then the Minnesota Department of Health has an excellent website, and you're able to obtain additional information there. So thank you. Elma?
Yeah. Yes, thank you, Robin. Now we can welcome the Culturally Responsive Caregiver Support and Dementia Services Program of the Volunteers of America.
Next slide, please.
Yeah, thank you, Gloria.
Good afternoon, everyone. My name is Gloria Coles, and I'm a community health worker with Volunteers of America. And my presentation today is going to be on coping with mixed feelings during the holidays and tips to manage holiday season stress. Next slide, please. First, I'd like to talk about feelings are unique. And feelings are just that. Feelings are feelings. Feelings are not facts. However, feelings are neither good or bad. Feelings are just that, feelings. The holidays can be difficult for both the caregiver and the care recipient. You may be pressured to keep up with family traditions and customs. You may feel anxious or reluctant to invite friends or family. You may even feel sad, guilt, loneliness, or even anger. These feelings can be a reflection of just how you're feeling at the moment. And also these feelings are also very normal because again, feelings are just that, feelings. And these feelings can surface often for caregivers. However, during the holiday season, these feelings can become even more intense. It is important that you acknowledge your feelings and that of your care recipient or loved one and decide how you would like to proceed. You may discover that you may choose to or choose not to celebrate during the holiday season. It's okay, because you do not have to worry or you do not have to let others' expectations dictate expectations for you. It is best for you to keep your calm and do things that both relax you and your loved one or care recipient. It is important that you share your feelings with others and let them know that your loved one's current condition. I want everyone to know, number one, that you are not alone. As Robin stated earlier about the statistics involving memory loss, Alzheimer's, and cognitive decline, they are on the rise because of our aging population. So you are not alone. Also, Volunteers of America, we have a caregiver support group. Support groups can help you to feel validated, and they can also assist you with helping you to learn more about what other caregivers are going through, and also let you know that you are not alone. Also, it is important that you seek education in regard to your loved one's condition and diagnosis. Lots of times people do not know that there are various forms of memory loss and Alzheimer's disease, and not all memory loss, not all Alzheimer's, not all dementias include memory loss. So that's why it is so important that you get a proper diagnosis, because not every form of dementia affects memory loss. Okay, sometimes it can be behaviors. So again, the more we know, the more we can be able to be better informed caregivers. Also, it is important that we pay attention to our nonverbal messages, to our body language, and to our tone, because many times your loved one or care recipient and others can pick up on this. Your tone and your body language say a lot more than just your words alone. Please remember that people may not remember what you said, however, they will remember how you made them feel. Next slide, please. Assist your care recipient or loved one with validating their feelings and emotions. It is important to recognize your care recipient's feelings and emotions. Talk to them, not at them. Persons with dementias and other forms of cognitive decline, they still have feelings. These feelings deserve your attention and respect. Care recipients and loved ones need to feel understood. And so sometimes they may have some challenges with expressing themselves. So again, it is very necessary that we acknowledge them and ask them how they are feeling. It is not up to us to make assumptions. So we need to share with them and let them know what is going on during the holiday season. Keep them as part of the planning, as part of the festivities, if you choose to have festivities. But it's important that we keep things simple, and if necessary, scale back on festivities. Sometimes we could be doing way too much. Know your limits and that of your care recipient or loved one. And so you don't have to feel apologetic. Listen. Cognitive decline and memory loss should be discussed and known to the family beforehand. You should talk about this and also listen. Listen and include the care recipient or loved one during these conversations, and let people have an opportunity to share their feelings, and don't be judgmental. A lot of times what happens is that people are really not listening. They're just waiting for their opportunity to speak. So it is important that both the caregivers and the care recipients be included in decisions that will impact them. Next slide, please. Next, I'd like to talk about ways to find joy. Finding ways to acknowledge the things that bring you joy. It is important, very important, that you acknowledge the things that bring you joy. It is so important that we do not try to give from an empty cup. It is so important that we take time for ourselves and not feel guilty about it, because that's one of the things that is detrimental to so many caregivers. They worry about doing things for themselves. If you need help, ask for it. Find ways to acknowledge the things that bring you joy, as I just stated, without feeling guilty. Ask your loved ones too about things that bring them joy. Let them decide what they want to do. Just because a person may have memory decline does not mean that they do not know what's going on. Sometimes they may get confused, but again, a lot of times our bodily actions and our tone of voice say a lot more than what we are actually talking about. And I just want everyone to remember that self-care is not selfish. It is important that you always remember to take care of yourself. Again, for caregivers, a lot of times this is also difficult because they feel as though if they do something for themselves, they are taking away something from the care recipient. So again, no matter what your intentions are, none of us can give from an empty cup. So please remember, you must replenish. You must replenish yourself so that you will be able to give and take care of your loved one or care recipient. Okay. Also, it is important when it comes to joy to find those things, no matter how small or insignificant you might think they are. It does not have to be a grand gesture. Sometimes you may say, I just need some time. I'd like to just sit down and maybe just read a magazine. Sometimes I might just want to take a bubble bath. Sometimes I just might want some time alone. Ask for help. You do not have to prove anything to anyone. So as I stated earlier, no matter what your intentions are, you cannot give from an empty cup. Self-care is not selfish. Next slide, please. So next, I'd like to talk about tips on how to cope with holiday stress. Sometimes it's important that we downsize. A lot of time for the person who has cognitive decline or memory loss, so many times we think that we have to keep things the way they used to be. I know sometimes some families, they could be large families, and you may have 40, 50 people over during a family gathering, and that was probably, well, it was definitely before pre-COVID times. But again, sometimes when you have a person who has memory loss or cognitive decline, it is important that you downsize, because again, this can be confusing to your care recipient, and it can also cause additional stress, anxiety, or agitation. Sometimes you may have to limit the number of guests. Or again, you may choose, in downsizing, you may choose not to celebrate at all, and that is a choice. Limit the number of guests. Make sure the guests are known to the care recipient. Also, it is helpful if you have pictures, and a lot of time older pictures of where the person may have remembered the person is a lot more helpful than a picture, a recent picture, because a lot of times a person may see a person and they may call them by a different name because they don't look like how they remember them. So sometimes pictures can really help. Another thing that can be important is that we scale back on activities. By scaling back on activities, this can help to minimize stress for both the care receiver and the caregiver. By scaling back on activities, you could spend more quality time with the people that you do have and focus on the activities that you choose to do. Also, by including the care recipient it can also help to make the person feel useful. Again, keeping a routine. A lot of times things such as helping to set the table, helping to wrap packages, things that the care recipient has been doing on a regular can help to minimize stress, and it also can help for both the caregiver and the care receiver. So again, by sticking to a routine, again, taking time out to talk to your care recipient or loved one about what is happening, when it is going to happen. And this is why it is also important when it comes to sticking to a routine. You may have to change some things around. Your family might be used to celebrating a holiday dinner, but evenings may not be good for a person with memory loss. So again, this could be a time where some people may be having sundowning. So this might be a time when you might want to decide, again, let's have something earlier in the afternoon, like lunch or brunch, something that more coincides with the schedule of the person with memory loss. Because again, this can help to minimize stress and anxiety for all persons involved. Next slide, please. Next, I'd like to talk about 5 tips to help manage holiday stress. Number 1, it is so important that we keep it simple. Keep it simple. Do less and enjoy more. Sometimes, again, we get caught up in doing grand gestures. Sometimes it's the simple things that people remember most. Again, establish a budget. And if you choose to exchange gifts, think about something that could be useful. A person with memory loss, sometimes things such as maybe magazines, something with large print, if that person enjoyed reading, clothing that is easy to remove, maybe something with elastic or zippers versus stuff with a lot of buttons can help that person. Also, things that actually come from the heart, such as maybe a homemade gift, something that the person that at a point in time they really enjoyed. Because a lot of times it's going back to those old things that make the person feel much useful. Again, listening to music, things of this nature, keeping things simple, things such as maybe a favorite movie or aromatherapy or their favorite cologne, something that brings back a pleasant memory for them. Number 2, now is not the time to worry about perfection. So many times we get caught up, again, in grand gestures. No one is asking you to be Martha Stewart. Keep it simple. Keep it simple. It is important that your expectations be adjusted, because for so many people with memory loss, when you start doing a lot of things that's outside of the routine, you're trying to impress your guests. This is not the time for that. Again, enjoy the holiday. Enjoy the holiday. Okay. You may also think about keeping things a little shorter, because one of the things that a lot of times, when you have, or in the past, you had all day events. A person with memory loss, this is so out of their routine. A lot of times the decorations, there may be people that they haven't seen in a long time. These can be stressors for the person with memory loss. So again, forget about perfection. Attend to your self-care. Don't overindulge, okay, in food or drink. And sometimes you might actually want to make your event a non-alcoholic beverage activity or gathering. Again, because sometimes this can cause, again, anxiety or challenges for all parties involved, those with or without memory loss. So again, it's important for your activities to stay as joyful and festive as possible. Okay.
Ms. Gloria, excuse
Yes.
the interruption. You have about 3 minutes left.
Thank you very much. Okay.
Yeah.
It is important that you maintain a healthy diet. Okay. Take time out, okay, and eat healthfully. Also take time out to exercise and to take care of yourself. Also, it's important that you make time to have quiet time when you need it for both you and your care recipient. Take that time out. Another thing when it's important to when it comes to self-care is get enough rest. Make sure you get enough rest. And a lot of times too, for your care recipient, make sure they get their rest. Don't try to keep the person up. Again, it's so important that you stick to your normal routines during the holiday season and day to day. If at 3 o'clock is when this person normally takes a nap, this is not the time to decide that you're going to serve dinner at 3 o'clock and expect that person to participate and there not be a challenge. Also, it's okay to tell others no. No, you cannot do this. No, you cannot bring an extra dish. No, you cannot. At this time, you may need help. So it's important that you acknowledge your feelings and your emotions. Again, if you need help, ask for it. Ask for it. You do not have to explain to anyone why you are requesting this. Again, you are a caregiver. And again, at this time, especially this time of the year, you need support and not be afraid. And number 5 is focus on kindness and gratitude. Okay? Take the time to enjoy the time that you're spending with your friends and family. Again, don't let yourself get caught up with tension and high expectations, because this is about us coming together and acknowledging friends and family. Next slide. And I want to share also too, that I want everyone to remember that self-care is not selfish. It is important that you focus on your physical, mental, emotional, and spiritual health. Find the things, again, as I stated earlier, that bring you joy. It is important that you recognize when you are stressed, because again, our nonverbal language, our body language, our tone, all of these things can be picked up by others. So again, recognize when you are stressed. Sometimes if you're having a headache or stomach ache, these things can be and should be conveyed. If you need help, ask for it. Also, it's important that you utilize stress management tools. This may be taking a time out, reading, doing some deep breathing, but taking time out for yourself. And don't forget to ask for help. Next slide. And our helpline information. To refer someone or for more information, please feel free to call our helpline. Our Volunteers of America helpline is 952-945-4034. And thank you very much.
Thank you, Ms. Gloria, for this wonderful presentation, for sharing all of your experience with us. Next, we have Mr. Armando with Phyllis Wheatley.
All right, good afternoon, everyone. I just want to talk to you a little bit about the tips and resources during the holiday season. As I look out, this season can be the most joyous time of year for many people, but it also can be the most stressful time of year. Because as we look around, some of us have lost some of the pillars that have been part of our families. They're no longer there. So how does traditions continue? So those are some of the things that we want to take a look at. But I don't know how many of you all know about Phyllis Wheatley. This originally was a settlement house in 1924, and that's going back a little ways. In a couple of years, we'll be celebrating our centennial year. But the settlement house was something like a place where you could go get resources, education, information, and guidance. I don't know if you all remember a movie not too long ago, about 3 years ago, called The Green Book. And it listed a lot of different places where African-American people had to go and stay because we couldn't stay in regular hotels. So the Phyllis Wheatley House in the community center started something in 1924. Now, hopefully we can continue to have that legacy to continue on today. And today we're in the neighborhoods of the African-American community, and we're providing services for the youth, for adults, and for anyone that wants to come and just share with us. Next slide, please. Now, a question was asked once before, why did you get involved with the CCC? That was standing for COVID Community Center Program with the Minnesota Department of Health. We wanted to do that to make sure that the African-American community received the actual facts when it came to COVID-19 and the prevention of this dreaded disease. Okay, because that's what I'm calling it right now. It's a pandemic, and it's attacking all of us. It shows no color, but for certain reasons, it hits some of the people of color a little bit more harder than any others. So we wanted to make sure that we dispelled some of the myths, because I still get this when I talk to people in the community. They bring up the Tuskegee experiment. That's the number one thing that they bring up. And I'm like, okay, that was 1940. Now let's come up to the 21st century. So we have to change the mindset of some of the people and some of the community members. Can you hit the next slide, please? The three things that I want to kind of really touch on real quickly here today because of time is communication, repetition, and social distance. Next slide, please. As we look at communication, especially in the home, it was mentioned earlier today about visiting loved ones. But as we take care of the loved ones and we look at families and friends that are going through this particular situation, festivities are really important, and we want to make sure that our loved ones take part of that. A lot of times when we want to make sure that things are happening, you know what, come down with me, aunt. Come down, uncle, sit here, and we get them involved in the planning process. I want to encourage you to also, this is a good time since we're going through COVID, to also help them clean. They can help you clean. This is what we need to do. This is our routine. These are some of the things that I want to stress to some of the people that are out there today. But also another thing that really stimulates is the music. Music really takes people back to a period in time. I know the patriarch of my family was Bishop Forbes, my uncle, my mother's brother, and his strongest asset was his mind, but it became a liability later on when he developed dementia. So what I would do whenever I spent as much time as I could with him, I put on music that he loved. But since he was a preacher and he was a bishop, I would play back his sermons, and it would take him to a period of time. He would just all of a sudden, he's there. And then I was able to have a coherent conversation with him. Now it was short-lived, but music, familiarity, this is what brought him to that point in time. So I would stress that if you have any type of music, my mother and father fell in love on a particular song that they told me about. So guess what? I would play that song as well. But those are the things that I would harp on right now when you're dealing with loved ones in the home. Next slide. Sometimes people have a difficult time in communicating the message to maybe other family members, to maybe other loved ones or friends. I wrote this right here, got this particular slide, customize it to whichever way you want to help bridge the conversation, to help make sure that you're able to talk to different people in the community, different people in the church, different people in your family about, hey, when you see Uncle Joe, he's not going to be the same person you saw 3 years ago. These are some things that you can look at, and this is a script that I put here for you all. Customize it to the way you think it should be for your family and for your situation. And I think this will kind of help start to the engagement and the dialogue with certain family members, and make sure that the care recipient is also a part of this. Next slide. Talking about communication again. Now, this is more or less in the public facilities. I mean, you might have to go to a particular home or establishment to visit someone. If you do, there's nothing wrong with bringing clean and sanitized decorations to their room. I would stress that. Make sure you sanitize it, you wipe it down. There was, I think Gloria talked a little bit earlier about familiar faces. You know, that can be an added bonus when like grandchildren, children, close friends, pictures of, hey, this is what we did when we were in Maui, you know, something of that nature that will help to ease the transition into, if they're in a home. Also the festive music, I harp on that. Being a musician, it's something that's universal. It transcends all languages. And so music can take you, like I said, can give them peace of mind, but it also can take them to a place that they're familiar with. Next slide, please. Repetition. This is very important. Normal routines are really important, especially during the holidays. Sometimes when you break up someone's routine, they get a little irritated. I witnessed this for myself. And then I was, okay, we need to go back to what we were doing originally. And so once we were able to do that and put things back into our normal routine that they were familiar with, everything seemed to calm down. So the stress went down as well. Once again, I said it before, limited unfamiliar faces, because you don't want to cause too much confusion within the setting as well and make them uncomfortable. Now, since we're in this pandemic, we also want to talk about washing hands. I usually talk to people, hey, let's do this together. And then I get them into that routine about wearing face masks as well. So this is an opportunity to discuss the pandemic with the care recipient and also the people that are around, that this is really important because this pandemic is not going anywhere right now. It is here. A lot of us, I'm sure, have thought that this might have been over with, you know, a year, but guess what? We got different strains. We got mutations that are happening. COVID, Delta variant, now you got Omicron. So who knows what else may be happening down the line. Testing, vaccination, booster shots can help. I know a lot of people don't believe in that, but I just want to encourage you to maybe have that conversation. And this might be the time to do so, because you might want to say to them, I know I did to my nieces and nephews when they wanted to see their grandmother, you got to go get your shots. And they did not want to miss spending time with their grandmother. So I was able to get 80% of my nieces and nephews to have their vaccination shots. So that's one thing we can do as well. Next slide, please. Social distance. That is really, really key. I come from a big family, and I know a lot of the big families as well. And one of the key things that we used to do, Christmas Eve was always the big hoorah for us. And we were able to have 65 to 70 people. Every Christmas Eve was at our house. So they would come, but the last couple of years, guess what? I had to cut it down to 20. And I told my younger generation, guess what? Use those social media platforms. We're going to be on Zoom. We're going to be on Twitter. We're going to be on whatever we need to be on to stay connected, because relationship is a key thing during the holiday season. Nobody wants to feel alone. And I'm here to, and I want to make sure that we encourage people to get, like I said, wear the mask, get your testing done, use Zoom when available, but also reach out to some of the people here on this panel, because you're not alone. You're not the only one going through what you're going through. And hopefully we can encourage you to press on and press forward just a little while longer. Everything gonna be okay. It really will. You know, and surround yourself with people that can bring joy to your life, that can bring something to your life, you know, where it's positive feedback, positive thinking. You know, I used to go through this routine. My wife used to always tease me, you know, she says, you know, every year at the end of the year, I look over my life and I say, okay, who brought positive things to my life? I keep them. The ones who continue to bring negative things, so long, see you, wouldn't want to be you. Now we can talk at a distance, but you have to take that negativity away from your life and their life. That will help diffuse a lot of the stress that we bring on ourselves sometimes. But that's what I have for you right now, of making sure that you get through the holiday season with this COVID happening right now, but safely. Continue to mask up, continue to wash your hands, continue to do all the hygienic things that we need to do to make sure that we're safe. So if you need me, like after our information, I believe on the next slide here, I got a hotline that you can call us, PWCC, that stands for Phyllis Wheatley Community Center. But you can reach out to us here. I will do what I can from the center perspective to try to help you as well, but some other additional resources, the web links are there. You can pull up some of this information and just take a look. But once again, we are praying for you. We're here for you. Whatever you need, you just reach out and touch us. Okay?
Thank you, Ms. Ramonda and Ms. Gloria. What wonderful resources and presentations. Thank you so much. We are getting some questions in the chat. Thank you, Tuesday, for answering, and please continue to submit them. Next, we have Miss Nancy with the Minnesota Department of Health. Hello, Nancy.
Hello, and thank you very much. What is the total amount of time that I might have today? I just want to be sure to stay within that.
Sure.
Time frame.
About 15 minutes. 15.
Okay, thank you.
Yeah.
If you'll give me a warning at the appropriate time, that will be helpful.
Yeah, absolutely.
So I am Nancy Lee. I'm the COVID Systems Coordinator with the Minnesota Department of Health. I'm going to move us to a bit of a broader framework of safety during the holiday, since we are, as Amanda mentioned, in the midst of COVID with surging cases, and it's not going away soon. And so we need to understand how this pandemic affects our holiday festivities and understand why we, particularly as African Americans, must be vigilant in our safety. Next slide, please. So my focus is going to be on the whole village that surrounds the person with dementia. And it is this group, that village, who are responsible for keeping the person with dementia safe. So first, I'd like to tell you about the work that I support, which has already been represented in some detail by the work that Amanda mentioned as a CCC at Phyllis Wheatley Community Center. MDH supports through contracts over 40 COVID community coordinator organizations who are community-based and culturally focused. And these organizations must have leadership and people on their staff who are truly connected to the communities and understand the cultural norms and values of their community. And the CCCs are serving a diverse set of communities that have been disproportionately impacted by COVID-19, which includes American Indian, BIPOC, LGBTQ, and persons with disabilities. And this all includes persons who may be immigrants to this country as well. Next slide. The CCCs are a conduit to provide the COVID-19 information in a way that is accurate and culturally nuanced, oftentimes painstakingly translated into languages that don't even have the words that we're using for this pandemic. So MDH provides the CCCs with education, documentation, and support to make sure that community members get access to needed healthcare, food, housing, employment, and so many more things that you can see here. The CCCs themselves have completed over 1,194 vaccination events that are focused on BIPOC communities, as an example. And the CCC events are available throughout the week, sometimes on weekends, for booster shots, shots for children. We now have shots for 5 to 11-year-olds, as well as first-time shots for anyone who might need it. Next slide. As I mentioned, the CCCs represent a diverse array of ethnic, racial, and cultural groups and are located throughout the state. So wherever you live, there might be someone or an organization that can provide you support around COVID. And so our topic today is how to keep our elders safe, especially with dementia or other debilitating diseases. And if they are kept safe, then we are all safe. So I'm going to take this unconventional approach in providing you data about COVID-19 so you have background information to share when you as a caregiver are dealing with family, friends, and others. And Robin asked that I talk about the latest COVID-19 Minnesota data and its implications for our older adults, caregivers, and families. So I want to state first that I'm not in the medical field, nor am I a statistician or an epidemiologist. My role through the CCC program is to provide education, support, and access to resources to help communities understand the implications of the data that we see in a practical way. So let's start looking at the following set of data slides. Next slide. So first, I'd like to talk about the positivity cases that we have. This chart shows the incidence of COVID cases per 100,000 residents. This type of age adjustment allows us to see more easily the disproportionate impact of COVID positive cases between racial groups in comparison to the white population. I've highlighted the Black African-American case incidence there, about 16,000, a little over 16,000 per 100, which is quite a bit larger than the white cases, as are several of the other ones. And in general, communities of color have higher rates because of the health inequities that are occurring among us, making us more susceptible to getting infected and more susceptible to dying. So when the data is adjusted for age, Black Minnesotans are testing positive at a greater rate than white Minnesotans. And it has been determined that unvaccinated persons who are younger than 65 years, who are in the communities of color, are 5 times more likely to get COVID. And those who are unvaccinated are 11 times more likely to get hospitalized. So we want to keep talking about vaccination. Next slide. So what I have here are the positive cases that are leading to death. On the left, you note how persons under 45 have the highest level of cases. That's at around 80,000. And then as the age group gets older, those number of cases go lower. However, when we look on the chart on the right, where we see that the large number of positive cases in the 80,000s for the younger groups, they have very, very low death rates. In contrast, you look at the older groups, 60 and older, even though the number of positive cases decrease, the number of deaths climb to significantly higher. So what does this indicate to us? Perhaps that underlying health conditions, diabetes, heart conditions, asthma, will produce more serious consequences for the older person, despite the fact that there are less positive cases. Next slide. In this slide, we look at the proportion of people vaccinated by age group. Perhaps you've heard the comment about herd immunity or the desire for Minnesotans to reach a threshold of 70% vaccinated, the governor had hoped. Well, we've not reached that yet. As you can see, the far right total shows us that the state as a whole hasn't reached the goal, and the chart shows the breakdown by age, alerting us to the reason why. Sure, you can look at those who are 65 years and older, and they're above 93% completion of their vaccination series, either 2 or 3, depending upon if they had an underlying condition, or 4 if they also got a booster shot. But look at those who are 18 to 49 years old, who will likely be socializing with you this holiday season. The darker blue shows that they are not completing their 2-dose series of vaccination as readily as others. The percent may seem small, but when you think about the numbers, it means a great deal. So the number of fully vaccinated people will not be the same as the number who completed their vaccination series. So we really have to be careful about who we are connecting with, and the idea, have they had their full series of vaccination is important. Next slide. This next slide of charts now looks at vaccination completion from the COVID-19 immunization records from a racial ethnic lens. On the left chart, we see how well Black or African Americans who are 65 years and older have done in their immunizations. If they started out, they have completed. 100% is based on the immunization records. In contrast, on the right, we can see, again, I'm focusing on the 18 to 44-year-old group of Black African Americans who, despite the months of opportunity to receive their 1 or 2 doses, or now even their booster, they only hover at 55%. So again, our younger generation needs to move forward. How can they continue to get their full dosage and move up the chart? So you might be asking, Nancy, why are you showing us these dire statistics? It's because I want you to understand the scope of the risk that you cannot see. It's not to make you fearful, but to encourage you to encourage others to get their vaccination. And by encouraging family, friends, coworkers, and others to care for one another, we help the whole. Next slide. In this chart, I'm looking at the breakthrough cases. This chart shows 2 sets of data. On the left, the chart shows the number of cases that have been breakthroughs, those hospitalized, and the total deaths among persons who were fully vaccinated. You know, you can note that the percent of fully vaccinated is 0.025%, a very small percent who died that was fully vaccinated. If you look on the right, this informs us in the green line, it represents that infinitesimal amount of people who die versus the blue line that shows us those who are not fully vaccinated who die. So I'm sure you've heard people complain, why do I need to get vaccinated if there's going to be a breakthrough anyway? It doesn't matter. Well, first, no vaccine is 100% effective for 100% of the people. So it's not about the vaccination that's the problem. What we need to think about is that by getting vaccinated, you're less likely to have serious illness and less likely for death, as both of these, the chart and the graph show. those who are fully vaccinated have the best chance of continuing a healthy, full life. Next slide, please. So I'm going to leave you with reducing risk and some safety precautions. And they're very much along the lines of what Armando has mentioned. I'm providing you these suggestions because they can be discussed in advance of people coming to the home. This helps you avoid a confrontation on the day of the event and assures that everyone who arrives will do so in a state of mind where everyone can have a pleasant and safe time together. So encourage all of the family members to get vaccinated and say, I'm sorry, but I can't allow you to visit this elder who already has a condition that's debilitating. Also, allow only those visitors who confirm that they are vaccinated to come to your home. One important thing is to require that anyone who's in the home properly wear their masks over their nose and mouth. You can gently remind the older adult who may have memory loss to keep their mask up, but it's really important for all of those who are visiting. And I want to make a plug for the proper type of mask, an N95 or KN95, which might be slightly less expensive. But these masks form a tight fit around the nose and mouth. Really, the cloth masks are not as effective. I mean, just not as effective. So if you really want to be safe, invest in some KN95 masks. Also, ask your visitors to take an at-home COVID test a few hours before coming to the visit, or a PCR test, which usually takes about 3 days to get the results because it's a very specific test. And then remember, after breaking bread together, to replace the mask back on your face as you're resting at the table, talking with each other, or going into the living room to watch TV, and gently remind your family members. It really is important. So next slide. So this last slide is, if all of these precautions fail, well, there is still an opportunity to keep your elder safe. If you find out that they may be symptomatic, someone calls you and says, I'm sorry, but I found out that I'm positive. What can I do? Well, make sure you and your elder get tested. If you have any symptoms, then before 10 days are up, there is a link in the chat for you to read how you can get treatment with the monoclonal antibodies. And at this point in time, there shouldn't be a cost to you if you have to do it. So look at that and be certain to get this treatment in advance of having to go to the hospital. So this is very important for all of us to remember. And other treatments are coming out. You're hearing things on the news as well. Next slide. So I thank you for your time today. I hope some of the information that I have shared with you will be helpful, and that you will continue to celebrate safely, making sure that you talk to people about getting their COVID vaccine shot, making sure that everyone wears a mask, and doing your best to celebrate safely. Thank you very much.
Thank you so much, Nancy, for sharing with us the vital information. It clearly shows that we can reduce our risks through getting our vaccination and also working on having a high quality mask to keep our loved ones safe. I know in my family, they have the list of rules for the holidays when you want to be with great grandma. So we've got 22 little ones that are under 18, and they are following the type of guidance that you and the other COVID community coordinators are sharing. So thank you. At this point, we would like to open it up for questions and answers. I would encourage you to use the question and answer feature. If you scroll down, Elma, can you scroll down to the bottom of your screen and you'll see the little box there that has Q&A. So if you will put your questions in there, we will be happy to take those for approximately the next 13-14 minutes. To start, I would like to answer one of the questions that came through the chat. And there was a gentleman that said, my doctor, my mom's doctor says that her memory losses are normal aging. I want to follow up on that. If there's no cure though, what is the benefit of having an early diagnosis of the disease? And so I'd like to answer that briefly. One of the benefits of following up and having your mother pursue a diagnosis is that while there are not a cure for the disease, there are medications that help manage the symptoms. And when you're managing those symptoms, your loved one can have a higher quality of life. But that is one of the important benefits of that. It also, when you have the early intervention, the elder is able to maintain their independence. Possibly longer because you can make plans for that. And there's also an opportunity to find out about clinical trials your loved one may want to consider. Like the biggest benefit to me is the ability to plan and engage in planning with your loved one. When we get a crisis diagnosis in a hospital and the doctor says mom can't stay at home or dad can't stay at home, now everyone has minutes versus months or years to make plans. And so that early diagnosis will ensure you have time to talk to your loved one about what their wishes are and put those plans in place. So thank you. Gloria, there were questions that came in during your presentation, and I will share one of those. It says, my mother's doctor says my mother's memory loss is related to age. However, your presentation suggests that she has AD or ADRD. Who should we take her to so we can get a firm diagnosis?
A referral to a neurologist would be very helpful in this particular situation because a lot of times our primary care physician, they are not a specialist. So when in doubt, always get a second opinion. Okay.
Okay, thank you.
And
Go ahead.
This is Carolyn Smith. I'd just like to add to what Gloria said. I know this gentleman was asking where could he take his mother for a diagnosis or evaluation. There are a number of different clinics that do have neurologists that can perform those kind of evaluations. One is in St. Paul is the Health Partners Neuroscience Center. That's in Minneapolis, called Minneapolis Clinic of Neurology. And I believe that the Park Nicollet Clinic in St. Louis Park also would be another resource. Just want to add that. Thank you.
Okay, yes, those are great resources, Carolyn, for families that want to see that specialist that might not be getting, as Gloria said, that attention from primary care. We also have a question, and I'll just open it to everyone on the panel. There is a question that said, I like the great idea to ask for help, but the person I'm caring for is firmly against getting any help from others. Any suggestions for what to do? It is easy to get overwhelmed.
Well, I would like to add again that self-care is also important. A lot of times we have to bring in some help. We cannot do it alone. And that's what happens to a lot of caregivers. And many times the caregiver is at greater risk than the care recipient because they're trying to live their lives and they're also trying to help their care recipient. So again, it is so important. Again, feel free to reach out to VOA, to our social worker, because Ms. Carolyn Smith, she can really help you in that area. Okay.
Yeah, thank you, Gloria. I would just like to add that this is a time to have a very difficult conversation with your loved one and let them know that you need hope. If you're going to be around long enough to continue caring for them, because it could be years and years and years, and you're, like Gloria said, you're at risk, for developing your own chronic diseases and illnesses. So you have to have the help and get support. If you need to have that difficult situation, like Gloria said, you can contact us and we can point you to some resources to help guide you as to how to have that conversation.
Okay, thank you. Nancy, we have a question for you here. They said, please talk more about the rapid tests and the treatment that is available.
I believe the website for the tests and the website about the monoclonal treatment, both of those hyperlinks are in the chat. I hope those are accessible to our audience. And what I can say is not all tests rapid tests are free, but you can get some at sometimes the local drugstores, whether it be Walgreens, CVS, others. I've heard prices range from $7 to $40. So there is a wide variation. So I would suggest calling first to ask if they have the rapid tests available. Rapid tests for families with children, I believe are available to go home with those children, but I don't know if they're at all schools. The PCR test, which is it can be a nasal or what they call a spit test, is available free of charge at the state's sites, different community sites. That should be done at least 3 days in advance of an event. So I myself have do it once a month, 3 days before the time I know I'm going to a meeting with people outside of my pod, I call it. They're outside of my family. If I don't live with them and see them on a regular basis and know their safety precautions, then if they're outside my pod, I want to keep those people safe by taking a test and myself safe. So you can find a testing location. I think there was a hyperlink added for that. If not, I'll double check. So the hyperlinks for some of the different tests and for the monoclonal are all in there. And the main thing about the monoclonal treatment is that you need to catch it early and not wait until you're feeling, or the person is feeling really, really sick and they're so sick they're in bed and they can't get up. If you feel like you're having symptoms and there is the idea in your mind, maybe you got it from somebody, or maybe someone calls you and tells you, then you should get yourself or your family member tested. If you're within 10 days, go online to that link, fill out the form so that you can get directed to a potential treatment. So that's when you're only mildly sick, you're not ready for hospitalization, and those treatment sites are outside of the city. There aren't a lot of them. But hopefully the treatment protocols are improving, and in the near future, next couple of months, there might even be treatment pills and other things like that. But that's what we have right now.
Thank you very much. And for those of you checking the chat, you will see links to the key information that Nancy was sharing. Dr. Gogler, do we have any other questions at this point?
Yes, thanks, Robin. Thank you for the just wonderful presentations and wisdom this afternoon. Just tremendous. And there was one last question, Robin, and it actually was directed to you. Robin, I am curious, are economic challenges a significant factor in increased propensity to acquire Alzheimer's and dementia earlier? So maybe this will be our last question for today.
And that is the economic, how that impacts. I'm sorry, Joe.
The question here is, are economic challenges a significant factor in increased propensity to acquire Alzheimer's and dementia earlier? That was the question.
I would say it does impact, and the way is really through the social determinants of health. For example, we know that if you're eating a healthy diet, that you will have less diabetes and less cardiovascular issues. The way economic impacts that is if you live in a food desert where there's only convenient stores and you can't access fresh fruit and vegetables, or you don't have the funds for those fruits and vegetables, then that's where there is a gap there with that. We also know that the quality of air and the environment, often those places that have the greater pollution and that have not been cleaned up from environmental hazards are often where BIPOC people live. And so the environment isn't as healthy as other places, but due to inequities and discrimination that people face, they may not have those same educational and job opportunities that, create greater wealth. And so when you look at the social determinants of health, lots of those link directly back to inequities, discrimination, and racism.
Mhm.
Thank you. Okay. I think we've answered all of the questions. I would just like to say that the Center for Healthy Aging and Innovation looks for continued collaboration with our community partners. We're so pleased to have Nancy Lee with MDH here with us today, Volunteers of America, Phyllis Wheatley. You will continue to see us work with UROC going forward as we build a future where people can enjoy their lives, celebrate their holidays, and reduce their risks. So thank you so much for participating, and we will send the slides to all that we have the emails for. Thank you.
Thank you.
Thank you. It's been an honor to have you all here today. Happy holidays and
Happy
safe,
holidays,
healthy
everybody.
holidays
All right.
to all of you and your families.
All right. Thank you.
Thank you.
And will you also be sending the links to the various items as well to the audience?
Yes. What I can do is it also include, in addition to the recording and the slides today, the content of the chat.
Okay.
A lot of great
Yes.
resources were shared there too,
Mhm.
by everybody. Thank you for sharing your experiences and your wisdom. It's been wonderful having you all here.
Thank you all for having me, ladies.
You're welcome. Thank
Pleasure
you
is
for
ours.
joining us. We appreciate all of the great tips and practical suggestions.
Thank you.
Thank you,
All right.
everyone. It was tremendous.
Thank
It
you.
really was. We so appreciate it. Take care, everyone. Have a great evening.
Thank you.
Bye.
Take care.
Thank you.